I've been a physiotherapist for many years, and for the last 6 years I've been using the Mi.TO synthesis table, which I believe is more than just a therapy table. I would say it's a therapeutic table. And the aim of today's presentation is that I want to show you how we use it in several ways in our practice. To keep it short, we're just going to demonstrate a few of the sequences that we would do with somebody with back pain. And if you would like to learn more about the actual sequences and the pathologies we can use the Mi.TO synthesis table with, we've compiled everything into a nice overview in a book which you can consult for more detailed information. Okay, so the Mi.TO synthesis table is more than a therapy table. I would call it a therapeutic table because through the different postures that we can take people in, we can actually almost provide therapy. So the point of today's demonstration is to show you very quickly what we can do with the Mi.TO synthesis table. And let's just imagine, as I'm a physio, so let's imagine that we have a patient with very acute back pain, and you all know that it's very difficult for people to actually lie down on the table on their belly or on their back. So we're just going to demonstrate how we start a treatment and take you through the different phases. We have a patient here. Let's imagine that she's got difficulties sitting down, so it's and lying down. So it's very easy to put her into a recovery position. And we all know as therapists that it's very difficult sometimes for people to breathe when they have acute low back pain. So it's fine to take a few minutes to explain to your patient also what's going on with their back and explain the pathology. And here we have eye-to-eye contact. We're at the same level, so we can use this opportunity to inform the patient and to relax the patient. We're not going to explain to you what you have right now, but at this point in time it's fine that we take this opportunity just to maybe teach some of the abdominal breathing. And like this we can start focusing on stretching the intercostal muscles and the pectoral muscles. We can go down a little bit. And we can focus on the abdominal breathing. We can provide some more stretch. And if you want, at this point in time, we can also use some manual therapy. And we could, for example, just release the diaphragm, breathe in and breathe out. We just hold for a few minutes here as she breathes in and breathes out. And this should relax the patient and help the patient to breathe normally again, breathe through the pain, as it were. And then we can bring the patient back. This would take a few minutes just in the practice. And as you know, the diaphragm is connected to the spine, so it kind of gives a natural traction to the spine. And when we're talking about traction, what we can also do is, as the patient is more able to lie flat, we can provide some kind of traction here through the legs. Or if we want, we can reverse the traction and we can use the thorax and the weight of the thorax, the gravity, to then have some traction as well. And if she lifts her hands up, that will be nice, bit of traction. We can increase that a little bit. And she can move her hands back and up again, and simply become aware of what's happening in the spine and become aware of the sensations, the kinesthetics, maybe even the emotions, some fear avoidance behavior, maybe we can talk about that. So this is all very quick in a few moments. She can lie in this position for ages, really, if you want to provide some traction. In the next phase, usually what we try to do is we try to go into some stretching. People will often have problems with the psoas muscle, for example, so what we can do is we can bring up this side, we can lower that side, and we can go into a psoas stretch and just relax and continue breathing normally. And if we want to do a little bit more stretch, we can obviously lower this part of the table. We have some more stretch in the psoas. And if we want to increase that even more, we can bring up this leg. We have more. And if we want even more, then we can go here. And she's actually starting to lift off here from the table. And we're using gravity. It's all very gentle, very relaxing for the patient. This is also great for sports regeneration. After some intense training, our patients or our clients then can relax a little bit more. Another stretch that we frequently do with back pain patients is the hamstrings. As you know, the hamstrings are also often connected, especially when we're talking about chronic back pain. We're talking about chronic back pain. In fact, before we go to the hamstrings, we may want to talk about people who have segmental pain and they have pins and needles down the leg because of an impingement or because of sciatic pain. So what we could do here is we could use this opportunity just to demonstrate how I would do some neurodynamic mobilizations. And if you put your hand here behind your head, what we can do is we can simply go in this direction, and then we go into the other direction, just the head up, and then just down again. And this is a very easy way to do your neurodynamic mobilizations. We can put some rotation into the hip as well, or we can lower the head section in order to have an increased range of motion so that we can slide and tension the neural structures better. If we go from here into a hamstring stretch, people often have problems with hamstring stretches. They're straining against the stretch, and the beautiful thing about this use of the table is that we're letting gravity do all the work. And when gravity does all the work, then the patients are very relaxed, and the patients can feel more what's going on, and they can relax more and go into the stretch and really work into it. Okay, we can also combine this with abdominal breathing, and we can go back again. And if you put your hands up here and up here, then she's really stretching, also opening up here and here, and that helps feel how breathing patterns and the myofascial, the deep myofascial system can affect all the muscle chains. We'll go back out of that and go into here. Okay, the beautiful thing about the table is also that we can use it to do simple mobilizations. I'm just thinking of a knee pathology, for example, or even if we want to work with sciatic pain, we can work here. We can go up and down and just mobilize very easily, go into stretch and see when she's in pain. And on the table we have some goniometers here where we can see exactly how many degrees we are achieving when we are doing our mobilizations, so we know where we are with our treatment. After relaxing the patient in this way and doing some stretching, we could go into mobilizations. And we can simply go here, work here, do some mobilizations of the spine. We can go lower, have some higher range of motion, and see when the patient starts having problems. Or what we can also do is we can start with some isometric contractions where she pushes this leg into the table and she lifts the other leg up, straight up, and try to keep the pelvis really nice and straight. Lift up the leg, yeah, and just hold it there. And this is a nice way of doing some isometric exercises, some stabilization exercises for the spine. Just hold in here. That's it. Very good. Okay, perfect. Lower a little bit and hold, 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 and relax. Okay, perfect. Okay, so we can use the table also to do isometric exercises and contractions, and we can do some activation exercises as well. If you can lie on your side now, for example, if we want to do some mobilizations or another stretch, for example, for the quadratus lumborum muscle, we can go here. Let's do this quadratus lumborum muscle. If we want a little bit more, we can stretch up here. We can lower this section here. We can go down. And we have more stretch here on the side. She's opening up all the intercostal muscles. And we can hold here. Okay. If we switch our legs, bottom one straight, we can see also by moving here, we can do a small test and see how her spine, if we keep the leg here, and see how the spine wobbles or how the spine moves, and see if there's any segments that may be locked or blocked. And if that's the case, we may want to go into mobilizations. Mobilizations are made easy. We can go into side bending. We can start our mobilizations here per segment. Or we can have a more global mobilization where she breathes in and out, look towards the other side. Just look towards the other side. The other side, yep. Okay, and we can also provide an impulse if we want, so that we get some joint cavitation. And then our patient can lie on her back, or on her front, rather. We can use this here to take some tension off the neural structures. We can do our mobilizations, posterior to anterior mobilizations through the spinous processes or through the transverse processes. If in some cases we want to add some rotation, then we can add that little bit of rotation here by just working with the leg segments, and we add some rotation. At some point we may want to go into extension. We want to use the Mackenzie principles. We can go into extension by using the upper controls. We can go up and down into extension and even to flexion if we want. If we want to block some segments, we can do that with our hand here. We can also do the thoracic part We're just using this part here. We're going up and down and blocking certain segments that need a bit more movement. Of course, then we can do our mobilizations, and we can provide an impulse. We can also, if she moves down a little bit more, we can go into neck mobilizations. We can add some rotation. If she just looks towards one side, we can add some rotations. And we can add some stretching as well for the cervical musculature. There we go. Okay, you can turn around now. Okay, and we can take our patient now as a final kind of exercise. We can go completely into extension just so you can see the extreme positions that we can achieve with the table. You can lift up again, and we always check the breathing, check that there's enough of abdominal breathing. For somebody who has back pain, often the sensation is very strange. People think that they are in this massive kind of yoga bridge pose, but as you can see, it's not, so it's very safe. You can come back. But we're letting gravity do the work, and we can target specific muscles. We're just going to put her up. And here, we're going to bring her up. And of course, if you have patients that you want to treat in a sitting position, then in your physiotherapy practice, your rehab practice, you now have a table that you can shape into a couch very easily. There we go. You can give me a hand, and I can take you away. Thank you very much. All of the techniques you've seen today here with the Mi.TO synthesi table are all described in great detail in this book, and there are many more techniques to be found in this book and sequences for different pathologies, also for sports regeneration. And Chinesport and the Global Posture Systems Academy also offer training courses all over the world. So please be in touch with Chinesport if you would like more information.